My name is Roberto Ruiz-Cordero. I am an assistant professor of pathology at UCSF in the division of cytopathology, where I perform fine needle aspiration biopsies on superficial lumps and lesions in different areas of the body. This minimally invasive procedure helps us rule out cancer or other processes like infections, and then we can use these results to communicate with our clinicians so that they can provide the best treatment for our patients. I also sign out our 500 gene panel for cancer diagnostics and detection of different biomarkers, and I specialize in the diagnosis of lymphomas and leukemias. What excites me the most about my job are many things. One, every patient is unique and each day is different, so that keeps my work fun and is not monotonous. I also feel very fortunate to be able to interact and work and learn from very outstanding colleagues. But I guess what excites me the most is to be able to interact with a patient, do a biopsy, look at his or her cells under the microscope, test those cells for different markers, look into their DNA to try to find specific targets, and then be able to integrate all of that information into a report that can help our clinical colleagues guide the best therapy for our patients. My plan is to develop a professional career in global cancer by leveraging my expertise in cancer diagnostics and harnessing all the resources and values at UCSF. I really hope to be able to bridge the gap between advanced molecular testing and underserved populations that currently do not have access to these technologies, which in many cases can be transformative for cancer patients and their treatments. My colleagues and I are launching a project in collaboration with Mexican scientists to bring comprehensive molecular testing for pediatric patients in Mexico. The impetus behind this collaboration is the dire rates of overall survival in pediatric cancer patients in not only in Mexico but in other constrained settings where the overall survival is less than 50%. In contrast, overall survival rates in the developed world can be as high as 90%. And so we've met with scientists from the National Mexican Institute of Genomic Medicine to discuss the implementation of a specific assay for pediatric cancer. In fact, we traveled to Mexico City back in January, and we've successfully set up a timeline for the implementation of this assay. Being named a John A. Watson Faculty Scholar is a great honor and a very humbling experience because I realize now that I'm part of this amazing and forward-thinking group of Watson scholars. But it is also a very big responsibility given the current situation. I think that this award that is intended to support people like me with diverse backgrounds, help people that are underrepresented, is a great opportunity for me and for others to have a significant impact in their care. I would really like to thank the leadership at UCSF and in particular the leadership in the Global Cancer Program at UCSF and the collaboration that they've started with Mexico for this opportunity to try to bring something to the table and help pediatric cancer patients in particular. I am also very fortunate to be part of UCSF at large because UCSF is an institution that characterizes itself um, by the pride values, and we as a group strive for outstanding professionalism in what we do, while we respect the integrity and diversity of our colleagues and collaborators.